Welcome to the Beauty Talk podcast, sponsored by G Skin and Beauty Institute, where beauty meets education and transformation. Today, we are honored to host Dr. Daniel Crane, a board-certified plastic surgeon and thought leader in the world of aesthetic transformations. With a passion for restoring confidence and empowering individuals, Dr. Crane is renowned for his expertise in full body contouring and mommy makeovers, helping women reclaim their sense of self after pregnancy and childbirth. Joining Inspire Aesthetics in 2022, Dr. Crane brings a fresh, holistic approach to patient care, tailoring every transformation to meet unique needs of each individual. Get ready to uncover the insights and procedures, patient care, and artistry behind the plastic surgery. Let's welcome Dr. Crane to Beauty Talk Podcast.
Thank you. Excited to be here.
Okay, so let's just dive into it. So talk to us about a few of your credentials and what got you into plastic surgery.
Okay, so, I spent a long time training to be a surgeon, and I started out my training in general surgery, which is quite a broad field. And within general surgery, you end up working with plastic surgeons, and I really liked those guys. They had a lot of energy and they did a lot of cool procedures. The guys that I worked with when I was a general surgeon, they were actually head and neck trained surgeons as well. And they were dealing with cancers in the head and neck, and they were using bones from the legs in order to reconstruct the jaw. And I had a good time hanging out with those guys. And that kind of got me into plastic surgery. And then I decided to do a plastic surgery residency, which is another 3 years after your 5 years of general surgery. And plastic surgery itself is quite a broad field. So within plastic surgery, you have to learn about hand surgery, the repair of craniofacial defects for children, cancer reconstruction, and then cosmetic surgery, which is kind of like a field within plastic surgery. And so during my training there, I worked with a number of cosmetic surgeons, and I would go to their office and hang out with them a little bit. And kind of the aha moment is when I was working with one of those guys, and we were doing a rhinoplasty on a 16-year-old, and she woke up from anesthesia and she was crying. And it wasn't because she was in pain. It was because she was just so happy to finally have had this procedure done, to had something that was bothering her basically her entire life. And within a couple hours, it was completely taken care of. And that's what really piqued my interest in cosmetic surgery. And when I finally decided that that was the avenue I wanted to pursue, because it's a small portion of your training in plastic surgery, I decided to do a cosmetic or aesthetic fellowship where I went out to Northern California. And it was actually during COVID, which actually turned out to be a major advantage because that was one of the busiest times for plastic surgery. People had a little bit of extra money, time to recover. And so I really had an excellent chance to learn about cosmetic and aesthetic surgery and come out fully prepared to offer people these types of surgeries.
So what I'm hearing is that you're truly passionate about what are you doing and the transformation that you're able to give these women and really their confidence back. And I just think that is so empowering for women and men. I think that it's so good to be able to feel like the version that you've always thought of yourself as. And I think it's like almost like miracle working. So that's incredible.
100%. That's the best part of the job.
Yeah. So what is your favorite procedure to do?
So I've really focused on the mommy makeover, and that's kind of been my favorite thing to do. And it's not just kind of one thing. A mommy makeover can mean different things for different people. And when we talk about a mommy makeover, typically we're talking about operating on the areas that change with pregnancy. And it also can occur with fluctuations in weight for people who haven't had a child. But typically we're talking about both breast surgery and abdominal surgery, because those are the things that kind of change the most with both those two things, pregnancy or changes in weight.
Okay. And so, what exactly is a mommy makeover?
So for the breasts, oftentimes, well, there's basically a couple options there. So, sometimes we'll place implants for women who have lost volume with pregnancy. Sometimes we'll do a breast lift because we know with pregnancy, things kind of stretch out, the skin stretches in the breast, all of those hormonal changes. And we need to kind of tighten the skin, reposition the nipples and the breast tissue. And then other times we'll do a breast lift and we'll also add implants so that we can add some volume while also repositioning the breast. And then as far as the abdomen goes, probably the most common thing that we're doing there is the tummy tuck. But some patients don't need an entire tummy tuck. Sometimes we're doing just a little bit of liposuction with a small amount of skin removal. So it really is catered based on the patient and their individual needs.
Okay. And when we were talking about like the muscle separation and all of that earlier, could you please explain really what's going on to like our audience with those muscles?
Absolutely. So with pregnancy or large fluctuations in weight, there's a couple changes that happen in the abdomen. And the first one is pretty obvious, is that the skin stretches. And there's a point where the skin stretches and then it doesn't retract. So one of the goals of a tummy tuck is to tighten the skin. And the second thing is the muscles, and this may be less obvious, but our abdominal muscles, all of us basically have a six pack on the inside when we're born. But with pregnancy or with large fluctuations in weight, those abdominal muscles can actually separate. And when that happens, the abdomen cannot be completely flat. And I also think that it kind of changes women. So women may have had an hourglass figure before pregnancy, and some of that hourglass becomes more of a rectangle. And tightening up those muscles allows us to flatten the abdomen while also reestablishing that hourglass. And I think another important point to bring up there is that both of these things really, unfortunately, the gym is not going to improve. Once the skin has been stretched and damaged, the only way to really improve it, oftentimes, is to remove it. And as far as the abdominal muscles, because they're positioned kind of in a vertical fashion, when you do a crunch and contract those muscles, they're contracting up and down. Nothing actually brings those muscles together other than something like a tummy tuck.
Okay, so then we were also saying like how this is like you're kind of creating an internal girdle to kind of snatch it back and give that contour back to the women's body, correct?
That's absolutely what it is. It's a perfect way to describe it.
Mhm.
And oftentimes, in order to further enhance that, I'm going to do some liposuction to kind of further enhance those curves right along that hourglass. And sometimes I'll carry that even into the back as well. My opinion is that the abdomen is really a 360-degree structure that goes all the way around, and oftentimes we have to treat it like that. And I think we get much better results when we do that.
Yeah, and so how do you determine exactly what a patient needs before you get in there or when you're doing a consultation?
So the first thing I do is kind of talk to a patient and see what bothers them, what they're looking to achieve, and then the next thing we'll do is we'll examine that person, and then I'll tell them kind of what the various options are in order to get to that point where they're able to achieve their goals.
Okay. So this is all customizable and no mommy makeover is the same, is essentially what you're saying.
Sometimes we're doing similar procedures for patients who may have similar anatomy, but yeah, exactly what you're saying. It's fully customizable. And yeah, each patient is going to have their unique set of concerns, and they're also gonna gonna get out of it kind of what they want, depending on, yeah, exactly.
Okay. And what is like the average age range that you're seeing in your office right now?
So for mommy makeovers, I think the youngest would probably be somebody kind of in their mid to late 20s. And just last week, we did a mommy makeover for somebody in their mid 50s. So that would be breast surgery and abdominal surgery. And I've done tummy tucks on patients up into their 70s. So, I think if somebody has an active lifestyle and there's something about them that they don't like, I think it's perfectly reasonable to consider these surgeries. And I think that those women oftentimes do very well. I think that, there's a difference between chronologic age and biologic age, and that somebody who's in their 70s, out there playing tennis, has a very active lifestyle, is going to do very well with these surgeries and may have a younger biologic age than somebody in their 50s or 60s that doesn't necessarily take care of themselves.
Absolutely. So, ladies, you heard it here first. It's never too late. It's never too soon. I mean, it's really just up to you and where you're at in your life. And obviously, living a healthy lifestyle is going to encourage faster healing, better results, all the things. So, don't limit yourselves. We can do this and have the body that you want at whatever age that you desire. It's never too late. That's
Absolutely.
really exciting.
Absolutely.
Yeah. So, this is something that I'm sure a lot of people ask you about, and we can only imagine what is actually happening. But can you break down what is actually happening to the belly button when you're doing these mommy makeovers?
Sure. So when we're doing a tummy tuck, sometimes people think that we kind of like take the belly button off, put it back on. Typically, that's not what we're doing. So for most tummy tucks, we leave the belly button exactly where it is, and we kind of make an incision around the belly button. And then we remove all of the skin from above the belly button down to a low incision that we've created. And almost like a sheet, we take that skin and pull it over the belly button. And then we make a new incision in that skin to bring the belly button out.
That makes all the sense in the world. And then we talked about how you try to eliminate the scarring around that belly button. What is it that you're doing to keep that scarring minimal?
So typically on the inside, we're placing some stitches that actually pull the belly button down. So when we attach that skin from the top to the belly button, that scar kind of tucks in a little bit and is hidden kind of a little bit on the inner portion of the belly button. And then
Okay.
for the other incision that we make with the tummy tuck, I actually have patients come in on the day of surgery and I have them bring with them a bathing suit that they like to wear. And I mark where that bathing suit sits on their hips. And I design my incision so that they'll be able to wear a two-piece bathing suit and that incision will be hidden.
Okay. And I just thought about something else. With a lot of women now also going like cesareans, they already have a scar there. What is happening when you already have a scar there and you're trying to pull this down and tuck it down? Can you eliminate that, or now will they have two scars?
That's a great question. Um, for almost every patient, I'm able to make my tummy tuck incision below where the C-section scar is. So we actually remove that C-section scar with the tummy tuck.
That is amazing. That is amazing. I do know like a lot of women that say, I will not wear a bathing suit anymore because of my C section. So, are women undergoing a tummy tuck to eliminate that cesarean? Is that an option or no?
Yeah, I mean, it certainly does. I find that nowadays a lot of those C-section scars are being placed lower because I think that OBs are maybe a little bit more conscious of trying to, give women a scar that can be hidden than maybe they used to be in the past. So I haven't had too many patients come to me saying that they're that bothered by the position of their C-section scar. But certainly, if somebody had a high scar, we would be able to lower it with their tummy tuck.
Okay, that's fabulous. And I'm sure it's encouraging for so many women. And I know that after a huge procedure like this, the last thing on people's mind really is scarring. But now let's say they have some scarring. What treatments are you recommending afterwards so they can eliminate them or make them look a little bit better?
Absolutely. So, I mean, scarring is always a question that comes up. And we do a couple of things to try to help with that. So, the first thing that we do is we give all of our patients a specially formulated silicone based scar cream. And silicone is one of the things that's been proven to help with scars as they heal. So that's the first thing that basically every patient across the board gets. And then there are a couple of additional treatments which I think can really help with scarring. Some of those treatments include microneedling, lasering, and then actually medical grade tattooing, which can camouflage the scar in areas where you're not going to tan, is also another really great option.
Okay. And me being in the permanent makeup industry, I've seen this actually happen for stretch marks. And we were talking about the anchor scar in the breast area. And I've seen really beautiful results with that. So you have options, ladies. Definitely follow your doctor's orders and recommendations first, but know that there's so many other possibilities to just really wrap up this whole procedure for you. Um, so then what going back into like the implants and we're talking about the anchor scar, what type of implants, what are we doing? How are you determining whether you're doing a lift, an implant, both? What's happening?
So again, some of that depends on what the patient's goals are. So the goal of the implant is to really add some additional volume. The goal of the lift is to reposition the breast tissue and also tighten up the skin. So that's going to be a discussion that we're going to have with each individual patient. If their breast tissue sits really low, and they're also looking to add some volume, then I may talk to them about doing both of those things at the same time. Um, yeah.
Okay, and what are the different types of implants? There's a huge thing about gummy implant or gummy bear implants. Can you break that down for us?
Absolutely. So, the two broad terms or broad categories of implants are going to be saline implants and silicone implants.
Mhm.
Saline implants are filled with saline, which is salt water, and silicone implants, which are now the more popular type of implants, are filled with a silicone gel. And all of today's modern day implants are really of that gummy bear type. In our office, we use Natrel implants, and there's basically three types of gummy for those implants. And the implant company has called that gummy, gummier, and gummiest. And basically, the gummy, which is still going to be gummy, is going to be the softest form of that gel. The
Mhm.
gummier is going to be a little firmer type of silicone, and the gummiest is going to be their firmest gel. So there's three levels of gummy, and the other implant companies have similar levels of silicone or gummy with their implants as well.
Okay, so the gummy implant is a silicone base implant.
Correct.
And then you were talking about the different volumes and shapes of these breasts. Like, what are our options?
So there's many options when it comes to which type of implant in terms of the gel, like we were just mentioning, also the size and also the shape of the implant. So
Mhm.
implants start out at around 200 cc's and go all the way up to about 800 cc's. So there's many choices in that range. And then implants come in different profiles. So
Mhm.
a low profile implant is going to be kind of the widest, flattest implant, almost kind of like a pancake. It's
Mhm.
not frequently used. Then there's something called a moderate profile implant, which is a little bit narrower, but still relatively flat. It doesn't have as much what we call projection, which is kind of the vertical height of the implant. And then there's something called full profile implant, which is probably the one I use most frequently, which is a little bit narrower than that moderate profile implant with more projection. And then something called an extra full profile implant, which is going to be the tightest circle, meaning the narrowest implant with the
Mhm.
greatest amount of projection.
Okay. And with this and choosing the type of implant that best suits our body, we would rely on you to kind of guide us, right?
Absolutely, yeah. So it's a discussion. So I typically employ two strategies to kind of lead that discussion. And the first is looking at something called goal photos. So goal photos would be before and after photos that somebody would bring into me, or we would kind of help them find ones that match their goals based on our discussion. So we look at a number of those photographs. And
Mhm.
then the second thing is actually a sizing kit from the implant company. So the way that works is patients try on a bra, and then there's inserts that correspond to different size implants, which go
Mhm.
in that bra so that the patients can kind of look and see how that feels in the mirror. And then at the end of that, we kind of pick a range of sizes that we're both comfortable with. And in the operating room, I use what are called sizers, which are temporary implants that I put in. And then I kind of put things together. I sit the patients up. They're still asleep during this. We look at the photographs. And then, I make the final decision in the operating room based on that discussion that we had about what's going to be the best implant.
Okay, right now that you're talking about the sizers, I could definitely recall like an episode on Botched where they kind of sit them up and it's like almost like an inflatable thing, correct?
So sizers can come. There are different types of sizers. So there are ones that can be inflated, much like saline implants. So saline implants actually come with air in them, and you remove the air and you replace it with saline. Okay.
Oh.
So sizers are very similar. You can either put air in them or fluid like saline and kind of blow them up, or you can actually use silicone sizers, which is what I use because they're a little bit more similar to the actual implant that's going to go in.
Okay. So now that we've decided what we want to look like, our goals, and we've treatment planned everything, gone through the surgery, what is the recovery on something like this?
So for a full mommy makeover, most patients are going to take, I'd say, around 5 days of pain medication.
Okay.
Um, with the tummy tuck, I usually do leave drains, which are little tiny tubes, which help to get fluid out from underneath where we've kind of lifted up the skin and tightened it. At the end of a week, those drains are typically ready to come out. And when I see patients at that point, I can see that their energy is back. Most of them come to the office. They're fully dressed. They got makeup on, and I could tell that they're feeling a whole lot better. And usually, their biggest complaint at that 1 week is going to be the drains, and that actually tells me that they're up, they're moving around, they're doing stuff. Because if they were just lying around, those drains would never actually bother them. And I'll let patients start to drive once they're off pain medication and once they feel comfortable behind the wheel, which, depending on where you live, I don't know where it is where you are, but here in South Florida, you got to be pretty alert behind the wheel. Um, I'll let patients get back to full exercise at about 6 weeks. And then the other important thing for patients is that I like them to be in a specific set of garments or fajas in order to help reduce some of the swelling and ensure that they get that contoured look. And we also recommend some deep lymphatic massage during those first couple weeks after surgery to
Mm.
help with those same things.
Okay, so how's that was going to be my next question that we actually didn't talk about because I've seen this a lot in the beauty industry here in Illinois, and it's these like lymphatic drainage massages. What are they doing there? Is there like a correct way to do it? Not correct? Like what's happening?
So these are specialized post-surgical massages.
Okay.
And, I usually tell patients if you're looking for somebody doing deep lymphatic massage, you got to go to a person that does this every single day. And that's the focus of their massage practice. So if you go to a massage place and, they're offering Swedish massage, deep tissue massage, and deep lymphatic massage, that's not going to be the place. So this
Okay.
type of massage is purposeful. It's not like, turn the candles on and the music type of massage. It's one that's designed to decrease swelling. I think it improves the result at the end of the day, and it also shortens the recovery time for patients.
Okay, so kind of like a little short side note story. I used to run a salon suite in Chicago, and the girl next to me specialized in that. And she would put her music up really high. And she would ask me, like, hey, does it bother you that this music is going on? I just don't want you to hear my patients. So, is this a painful procedure?
So, in the first couple of days, imagine you just had a big surgery, right? We operated on your breasts, we did your tummy tuck, we did liposuction all the way around your back. and now somebody's trying to massage you. So there is going to be a little bit of discomfort during those first couple of sessions. And I usually have patients take their pain medication before they go to their
Mm,
massages.
okay.
But what I find is, despite that initial discomfort, patients actually really enjoy these massages because afterwards they've moved a lot of the fluid out of those areas, and fluid, swelling, inflammation, all of that stuff causes pain.
Yeah.
So afterwards, I think they do feel some relief. And after that initial stage, those first couple weeks, patients start to really enjoy the massages. And I have some patients that they'll be, 2 or 3 months post op, and I'll tell them, hey, you don't need any more massages. Most of your swelling is gone. And they tell me, hey, you know what? I just feel great after I get them. I may get these for another several months or maybe for the rest of my life just because they like the way it makes them feel. And I
Yeah,
think,
they're just so good. I mean, I've seen these women get, like, really snatched up,
yeah,
getting, like, all this woodwork
yeah,
stuff.
totally.
So is there a contradiction to, like, not removing that fluid, or you just leave the drains in longer? What's going on?
As far as not getting the massages,
Yeah.
so I think, if there is actual fluid that you can see, it has to be removed. But a lot of times the massage people, they're not, it's more fluid within the tissue. So I think it just kind of speeds up the recovery process and lends itself to a better result. I don't think it's the end of the world if somebody doesn't get massages, but you have a pretty big investment here in terms of your time, your money, all of the recovery that you're going to go through. So to
Yeah.
get a couple massages, it's a small piece of the puzzle, but I think if you want to enhance everything, that's something that you would go ahead and do. I mean, 20 years ago, I don't think anybody was really doing deep lymphatic massages, and
Mhm.
patients did okay. But if we want our patients to get the absolute best results, I think it is important.
All right, y'all. So don't skip out on these massages. Get at least a couple of them. You don't have to like be there every day or once a week, but protect your investment. You've already done all the recovery, all the expenditure, just like Dr. Crane just mentioned. So just get it done. And do you partner with certain people there at your clinic, or are they sent out somewhere else?
So for us, actually, we don't have massages within our office. I have a list of people that I kind of trust, and
Okay.
and that list has been generated by the feedback I get from my patients.
Mm.
So those are kind of like my people, and those are the people I recommend. And sometimes we add to that list. So I can have a patient that they live somewhere where they couldn't access some of the people on my list, and if they find somebody and they're like, hey, this person took really great care of me. I'll meet with them, talk to them, and if it's a good fit, we'll add them to our list of recommended people.
Okay, awesome. So one more question before we log off here. Um, I know that a lot of people are probably flying out of state to come and see you. Are you recommending that they stay put for a week? What is like the game plan there?
Absolutely. So I mean, it depends on the procedure. So the bigger the procedure, the longer that I'm going to want somebody to stick around. And probably the biggest procedure is something like a mommy makeover. So I mean, if we just did a portion of that, the time could be shortened. Let's say we only put in breast implants, somebody wouldn't need to stay as long. But most people, I'm going to want them to stick around for a week. And that would mean that they would have to be here just a little bit longer than that, because I also don't like to meet patients in person for the very first time on the day of surgery. So typically, how this would work is that I would meet with patients on the camera. We would discuss what their goals are, all the details of the procedure. And then prior to the actual day of surgery, we would meet in person so that we could go over all that stuff again, examine them, make sure everything is set for surgery day. And then the following day, usually because most people are trying to squeeze their visit in and get back home as short as they can. That following day, we would do the surgery, which we do in our office. We have an office based surgery center. And then I would see the patient the day after that, so their first post operative day. And then I would see them before they go home again, just to make sure that everything is good with them before they hop on the plane or jump in a car to go home.
Okay, and I did think of just one more thing. Just
Sure.
one more thing really quick.
Yeah.
So are there some patients that just are not good candidates for a mommy makeover?
So yeah, there are some things that would make you not a good candidate. So, if you had pre-existing medical conditions that would make the operation unsafe. People that use nicotine also aren't good candidates for things like tummy tucks and breast lifts.
Mhm.
And then, we do calculate something called BMI, which is kind of like
Mhm.
a ratio of your height to your weight.
Mhm.
And really, we want patients to try to be at an ideal weight when we operate on them. And that's going to be patient specific. But if somebody's BMI is too high, we may say that it may be best for you to try to lose a little bit of weight before we go ahead and do the surgery.
Okay, so there can be some game planning before these procedures. Make sure that you're talking to a professional so that you can get prepared for something like this and so you can plan everything out. There is clearly a game plan that has to be established, prior to and after, especially if you have children. So make sure that you're getting all of those things, wrapped up before you go and do a big procedure like this. And today, Dr. Crane, thank you so much for joining us on this enlightening podcast of Beauty Talk Podcast. A huge thank you to you, Dr. Crane, for sharing all your wealth of knowledge and expertise. We hope that you have learned something new and feel inspired to elevate your beauty and wellness journey. Don't forget to subscribe. Follow us on social media and visit our website at beautytalkpodcast.com to stay updated on upcoming episodes. We'd love to hear your feedback and leave us a review and let us know what topics you would like us to cover next. And finally, a shout out to G Skin and Beauty Institute for making this podcast possible. Share this episode with your friends, and until next time, stay confident, beautiful, and informed.